how can we make sure new science, new interventions, new innovations get into the hands of those who need it the most, who are waiting for more direction and more good news. The ultimate goal is to help bridge this science to practice gap, right? In order to do that, we need to make sure we go beyond sharing with other researchers and scientists, but patients, individuals with lived experience, practitioners, stakeholders, community-based organizations, advocates. We've had over 9,000 engagements with the Eat, Sleep, Console content that we made for stakeholders. We'd had over 5,000 engagements with the Brain Initiative study, and we've had over 19,000 engagements with the ORCA framework, right? And that's just since December, right? So that shows that we're building and growing this mechanism for you all that can push your work, your hard work out, and find more stakeholders and patient groups and community organizations that need to have access to that information.
We are a very proud HEAL Connections Associate Partner. NICOA's mission has been to eliminate the adverse effects of drugs and alcohol on children and families. We provide tools to educate the community about the impact of substance use disorder on children and families. This was one of the first HEAL projects to be supported by the HEAL Connections for results dissemination, which I and we at NICOA were very proud to be part of. And if the researchers are here today for ESC, I want you to know I want to hug you. This was such important research and so applicable to what we do, so thank you.
Nothing about us without us is the rallying call of the international disability rights movement. And it basically stands for the idea that research and policy shouldn't be undertaken without the input of those groups that are likely to be most affected by their outcomes. This is a political and ethical mandate, but it's also a practical one if you want your research to have meaning and impact. Nicely, both HEAL and HEAL Connections have embraced this idea by including people with lived experience at every stage of the research process, from inception through translation. So the HEAL Connections team really acts as a bridge. They meet with NIH leadership and study leads to figure out what dissemination needs they have, but then they also meet with stakeholders and groups like ours to decide what's going to be most relevant to our communities. Big picture, as Jess mentioned, really the idea behind HEAL Connections is meaningful bi-directional communication. And the team does this in a few basic ways. The first is through hosting quarterly listening sessions that involve both NIH leadership and the stakeholder and patient engagement groups. The second is through co-production of materials. And let me be the first to tell you that it is absolutely true that stakeholder edits are incorporated and that the materials are not distributed until everyone's concerns have been met.
We are really excited to talk about the opioid overdose reduction continuum of care, or ORCA, and the results to the field. So this is super exciting because what this really did for policymakers is really distill a lot of research and practices into something that was digestible and usable. I think the key piece of this is just like making things digestible for different audiences, and for policymakers, they're really busy. So if we can get things that's digestible to them, that's really clear to their staff, to their team members, so they can do, legislation, but also administrative policy changes or changes within the court system are just as important as well. So it's really important.
It's not the goal of publishing, it's the goal of getting into the hands of people to translate that work into action. So I think every researcher should have a portion of their budget, their time, and how are they going to actually get into the hands of someone like me. So I was really excited when I found out what the HEAL Connections program was. And I really encourage you all as researchers to get these things in our hands, because we can act on it very quickly when it's digestible. So we get into the hands of the doctors and the nurses, we get into the hands of the administrators, and that road splits and we can work in parallel on getting this done. That road eventually merges back where practice meets policy, and that's where the real change makes. I need the information from this research in multiple tools so I can educate a doctor, an administrator, a nurse, the community, our peer specialists.
Really, the important piece here and why we're here with the HEAL Connections and working closely with these organizations and Jess at the Addiction Policy Forum is because this brings all of us together as an incredible force to disseminate this information, but also advise. We're not just being told what's happening, we're actually being asked, what would be useful for you? What are the topics and how do we create actual bite-sized information? But the important thing is all of these organizations that we work with have dozens or hundreds of peer specialists that are actually wanting this information to help talk with the people they work with that they're helping because it gives them hope. Your research is giving them hope that they can get better, that their brains can change. And ultimately, this really brings hope to a whole community of people that know that you're working to help future generations. So thank you.
One exciting thing that we're working on in HEAL Connections is to actually start tailoring even further all of these amazing knowledge translation pieces of science for you. We want to make sure that we get the content right, that it works for you. How do you need it? Do you like a video explainer? Do you want to pass out a flyer? Do you need to have an infographic? Is this about a layperson summary? So we're making a priority to start venturing into that lane so we can build better products for all of our leaders with lived experience to help us get information out about new science and new interventions. So give us 6 weeks and we're going to have a toolbox for you.